Please stay on mute.
Meeting is called to order.
Hello everyone, a very good evening. I request President Rotarian Lal Goel to please confirm the minutes of the last meeting.
The previous meetings minutes were circulated, and as we have not received any objection or observation, so I presume that everybody has read it, and so I confirm the minutes of the previous meeting.
Thank you very much. Moving on in the session today, so the agenda for the session is talk on how to keep liver healthy, and it shall be given to us by Dr. Amit Singh Barpa, who has joined us, and he's an MD Med, DM Hepatology, MRCP Gastro, Consultant Hepatologist, Liver Transplant Physician at Vishesh Jupiter Hospitals in Indore. I would now also like to take the opportunity of sharing his brief introduction with you all. So, Mr. Amit Singh Barpa is a consultant hepatologist and liver transplant physician at Vishesh Jupiter Hospital, Indore. He's a trained hepatologist and endoscopist. He is in managing various complications of liver diseases from diagnosis to treatment to management. He's proficient in the delivery of medical advice with a focus on patient illness assessment, preparing diagnosis, and planning management, especially in critically ill ICU-bound liver patients. He has vast experience in the recommendation and prescription of medications to patients with liver and GI diseases, including liver transplant. He has done research in plasma exchange, which is a promising treatment modality in severe alcoholic hepatitis patients, accepted abstract in APDW December 2019. Safety and diagnostic yield of double balloon enteroscopy, MedEdge 2019. Role of echocardiography in acute rheumatic fever as compared to Jones criteria, International Journal of Medical Research and Review 2015. Low volume plasma exchange PLEX along with low dose steroids improves short and medium term survival in severe alcoholic hepatitis patients. A case control study accepted abstract Indian Journal of Gastroenterology 2019 volume 37. So I welcome you, sir, on behalf of Rotary Club of Organ Donation International, and we really look forward to hearing from you.
Thank you, ma'am, for such a nice introduction. It is my pleasure to be in front of Rotarians. And today's topic of discussion actually will be liver health. So I'll be just sharing my slides. Am I visible, sir?
Your screen is there, but yeah, it is there. Liver health.
Okay. Sure, sir. So I'll be starting my presentation. So we have to understand one thing, like all over the world, usually the topic of discussion is more about cardiac health, more about mental health. But liver is something which is equally very important. And most of the time, actually, liver is like behind the curtain. So today, the topic of discussion will be more focused on the liver. And liver is the largest solid organ in the body. It is, in fact, the largest gland in the body. And liver is the only organ in the body actually which has innumerable functions. If we have to point out the functions of liver, it may likely be around 50. So liver body में सबसे बड़ा organ है, functions बहुत ज़्यादा है. But in nutshell, actually, we have to summarize two basic functions of liver actually are synthesis, which is to make proteins, which probably will help in immunity, in managing various hormonal axis in the body. And the second basic function is detoxification, because whatever we eat, जो भी हम खाना खाते हैं, It is the nutrients are absorbed via gut, and the first organ to take out that nutrition and to handle that nutrition product and toxins actually is liver. So it is a central manager in the body that we have to understand. Liver disease, if we have to ask all over the world, actually, especially fatty liver is in the epidemic. If we have to like give the data, so up to 40% of Indian population actually now has fatty liver, which is the name, the nomenclature of the fatty liver disease has recently changed, and it is actually now called as metabolic dysfunction associated liver disease. If we have to summarize the causes of liver diseases, the number one, as I told you, is fatty liver. Number two is alcohol-related liver diseases. Number three is viruses, especially hepatitis B and C, which can lead to chronic liver diseases. Number four actually will be drugs, which again is a big basket, which includes over-the-counter medications, herbal medications, many a time anti-TB drugs, and there may be other rare causes of liver diseases, which will be like more or less genetic related liver diseases, autoimmune related liver diseases, and sometimes vascular associated liver diseases. So I'll be focusing my talk a bit more on fatty liver disease because it is the major chunk of liver disease what we see now. So up to 40% of Indian population has fatty liver. Fatty liver in long term actually can lead to liver cirrhosis, even liver cancer, but only in few percentage of the patients. Not everybody who has fatty liver will have liver cirrhosis and liver cancer. Less than 1% of the population who are harboring fatty liver can have complications which can lead to cirrhosis and cancer. One more thing which we have to understand that patients who are harboring fatty liver, they are the main killer in them actually is not only the liver disease but also cardiovascular diseases and other cancers, which can be esophageal cancers and other GI related cancers. Liver is an organ actually which usually won't give you symptoms till late in the cycle. Like patients who are harboring fatty liver or who are having advanced fatty liver diseases also, they usually will be asymptomatic. होता क्या है कि when usually patient goes to regular checkup and they get their sonology or sonography done, the sonologist will report fatty liver and the retrospectively patient will get to know that their liver is getting damaged because liver is an organ in which symptoms won't appear. Usually symptoms appear very late in the cycle. Fatty liver disease, the main reason for fatty liver disease is lifestyle, especially inactivity in combination with sedentary lifestyle and poor eating habits. Nowadays, what is happening, like more and more population is into IT. And till the adolescent or young age, everybody is active and do exercises. Once the youth population is going into their job, the life cycle will become like that. 5 days in a week, they will be working, which will be usually sedentary. And on the weekends, it will be party. So it will be binge eating coupled with alcoholic beverages also. So this combination actually is very lethal, which leads to fatty liver diseases. Fatty liver disease, as I told you, actually, again, is a basket of diseases in which, to begin with, it may be just fat in the liver. If it progresses, it can lead to liver cirrhosis and liver cancer. So what every person actually who's touching the 40 or who is 40 plus, my suggestion will be they should always get basic screening testing done. So number one step in the liver health actually is to get yourself screened for basic testing. What should be the basic testing? It should be basic liver function test, which should include bilirubin, SGPT, SGOT, or liver enzyme levels, coupled with a abdominal sonography, which can structurally tell us how is the liver. And we should always screen for the viruses, which should be hepatitis B and hepatitis C. Because if we are able to screen us out, then we'll get to know how bad is the problem. As I told you, because patients with liver disease, they will have symptoms very late in the cycle. If on testing we are getting to know that patient is having fatty liver, number one thing what they have to do is to change their lifestyle. If you ask me, like, are there any role of medications, pharmacotherapy? Yes, there is role, but in a limited subset of patient. But in that subset of patient also in which pharmacotherapy is helpful, the key to the management of fatty liver disease is changing the lifestyle. What we have to change in the lifestyle? Number one, we have to start exercising. We have to understand that there is no shortcut. Exercise in combination with a balanced diet, which will lead us in a bit of calorie deficit, is key in the management of fatty liver disease. We have to understand that fatty liver disease happens because of calorie surplus. हम खाना ज्यादा खा रहे हैं और inactivity है, उसके कारण our bodies is getting more calorie than what is required. So usually it is because of calorie surplus that bank account usually अपने को calories बढ़ता जाता है और liver में fat deposition होने लगता है. So number one step is that we should start exercising. Usually patient asks us, sir, what kind of exercise we have to do? So we have to understand that we have to do at least more than 200 minutes of exercise in a week, which should be about 40 to 50 minutes per day. And we should combine cardiovascular exercises along with weight training. It should not be alone weight training or alone cardiovascular exercise. It should be combination of both. And our target should be to do at least 4 to 5 times in a week and should be about 40 to 50 minutes per day. Is my voice audible?
Yes, please go ahead.
Yes. So combination of exercise along with good diet is key to liver health in patients with fatty liver. Many a times patients or like in general population, there is always a myth कि सर मैं liver 52 or some any other medication खा लूंगा या liver का मैं detox करा लूंगा तो my liver will be healthy. So we have to understand that there is no specific food item, there is no specific medication which can make your liver healthy. There are no shortcuts. Cutting the long story short, it is combination of exercise with a healthy diet. Healthy diet, what is the definition of healthy diet? In healthy diet, we have to make sure that we are equally taking carbohydrate, protein, a bit of fat, along with minerals and vitamins. The main crux of the story is that we have to restrict calories. Whatever we eat, either it may be carbohydrate or fat or protein, everything contains calories. So we have to, in patients with fatty liver disease, whatever kind of diet they are eating, they have to maintain a calorie chart. They have to maintain a calorie deficit of around 400 to 500 kilocalories, coupled with exercise that will basically solve our purpose. There are no shortcuts. There are no specific drugs which can make your liver healthy. There is role of some pharmacotherapies, like some drugs, especially like vitamin E, pioglitazone or saroglitazone, but their role actually is limited to very limited subset of patients, that too for a limited time period of time. So practically there are no shortcuts. So step number one, as I told you, is that we have to get ourselves checked up. We have to screen for basic viruses. We have to get our blood labs done. We have to rule out viral diseases, because many a times the cause of liver disease will be just hepatitis B or C viruses. If that is the case, then probably we have to take antivirals. Step number two actually is doing exercise, taking the balanced diet. Again, one more topic actually, which is like every second patients, if you are practicing hepatology, will come to you with history of alcohol intake. And many a times patient always ask us, sir, how much quantity of alcohol is safe for us? So one thing we have to clearly understand, like WHO has now clearly mentioned that no amount of alcohol is safe. Alcohol is a carcinogen which can actually lead to high chances of esophageal and oral cancers. But if we have to link alcohol with liver diseases, which is the most favorite organ for alcohol to get damaged, if we have to define any particular dose of alcohol which can lead to liver damage, in that case, we can quantify the alcohol, which usually is like people who are taking more than 30 grams of alcohol per day for about 4 to 5 days in a week. They are the subset of patients who have more chances of getting alcohol-related liver disease. But again, there is no fixed quantity as such. because every individual has different genetics. Every individual has different body type. A person who is already harboring fatty liver disease, who takes even a small quantity of alcohol, he can develop liver cirrhosis. So any amount of alcohol usually is not acceptable in patients with liver diseases. People who are healthy, doing exercise, maintaining very good lifestyle, taking balanced diet, probably like less than 2 drink per day is acceptable, but that too we have to, it comes with a red flag that alcohol itself is a carcinogenic. Although that amount of alcohol which we are taking is not dangerous enough to liver, but it can lead to other complications, which can be cancers. So that actually clearly, like guidelines from WHO has now told. So the crux of the story, the crux of the talk actually is like changing lifestyle coupled with balanced diet and getting regular health checkup, doing exercises is key to the liver health. And we have to understand like there is no shortcut. It's not diabetes, heart disease, or liver disease or obesity which runs in the family. It's that no one runs in your family. That's why you're having all these diseases. So that was my small talk. I think the house is open for now, like questions. I'll just end the presentation.
Thank you. Thank you very much, Doctor. Just close the slides so that we can start.
Yeah, just
Yes, please.
So you'll have to stop screen sharing.
Yes. It's not coming actually. I have to just click it down. Yeah, start. Okay, I've stopped the share.
Yeah.
Yes.
So thank you very much, Dr. Amit, for giving in details about the liver, because the main problem in India or everywhere in the world is the liver. And you rightly said about the alcohol, but you have not quantified the quantity which one should take, because the members of Rotary Club of Organ Donation International, majority of them consume alcohol. But the only thing is that how much quantity one should consume, it is a matter of things. So can you just identify in the pretext of India, an Indian persons, because you know the Indian body composition is different than the Western countries persons, how much whiskey one should take, and what is the duration, how many days every week one should consume? Can you just quantify that?
Yes. So basically, sir, if you ask me like what is the quantity of alcohol which can lead to damage to the liver, if that is your question, so we have to understand one thing, like alcohol in different countries is defined by one standard drink. Usually in India, one standard drink is about 10 gram of alcohol. So अगर हम उसको quantify करें तो 30 ml of whiskey usually is about 10 gram of alcohol. So 2 packs, usually if you are taking 30 ml, 2 packs of whiskey, it is considered to be safe, but it comes with a disclaimer. What is the disclaimer? Even if somebody is taking 2 packs of whiskey per day and the baseline liver functions are not good, they have very high chances of getting liver disease. So number one is we should check the basic lab function done. We should take healthy nutrition. We should do proper exercises. And if we are coupling this with about 2 packs of whiskey, then probably liver should not get damaged. But again, it again comes with a disclaimer that every body is different. Whatever data we are presenting is more or less Western data. Western population actually, they have more capacity of taking alcohol because of their genetics. And this amount which I have told you, like 20 gram or 2 packs of whiskey per day usually is, and that too about 3 to 4 days in a week, usually safe, but this is a Western data for a Western male. For Indian patient, this will be even less, and for Indian females, it will be even less. So this thing is like, it comes with its own disclaimer. This is for liver disease, but in general, if you ask me, WHO clearly says that any amount of alcohol is not safe.
Okay. Okay. Thank you, Dr. Amit. Before I will open the forum for the to everyone, one last question from my side is, if the liver cancer occurs, can a liver transplant can be a cure for the liver cancer if the liver is transplanted?
Yes, yes, definitely. For liver cancer, liver transplant can give us cure. But the management of liver cancer actually depends on the staging of liver cancer. That actually depends on the size of liver cancer, location of liver cancer. So there are various criteria. Actually, there is a criteria by the name of Milan criteria. If liver cancer is picked up early and the size of the liver cancer is small, in that cases, doing a transplant definitely can give us cure.
Okay, thank you very much. Now the forum is open. Whoever wants to ask the question.
Just one second. Please do not unmute yourself if I have muted, unless you are asking a question. So that is for everyone here. Now the question that I think that Dr. Lakshmi Goyal wants to ask a question. She's raised her hand, so I'll pass on to her. Dr. Lakshmi Goyal.
Yes, thank you. And thank you for an excellent talk, Dr. Amit. My video is off because I'm traveling, so pardon me for just using voice. So my question is, you said medication is not the best or the first resort, but are there any natural supplements or vitamins or particular foods that one can take that might help with fatty liver?
So for fatty liver, actually, ma'am, as I told you, like balanced diet definitely help us out, which should be like enriched with fruits, vegetables, equally good amount of carbohydrate and proteins. If you ask me like any vitamin which has a role in the treatment of fatty liver, then vitamin E definitely has a very good role in the treatment of patients with fatty liver. But it should not be a blanket therapy to each patient who are having fatty liver. What we have to do is we have to evaluate further a patient with fatty liver, which actually requires further testing, which may be fibroscan, which probably non-invasively tell us whether patient is harboring fibrosis. Because usually when fatty liver progresses, there will be some amount of inflammation or injury in the liver, which can lead to fibrosis. So in patients actually who are having fibrosis but no cirrhosis, coupled with lifestyle modification, exercise, definitely vitamin E has got very good role. This has been actually showed in the past with trials. One very important trial, which was Cleveland's trial, which was conducted in patients with fatty liver who were having fibrosis, and vitamin E was given to them, and some amount of improvement in inflammation and some amount of improvement in the fibrosis was noted in them. So definitely vitamin E has role. Other over-the-counter medications which are more like on the side of marketing, we don't have enough data to prove their role. But lifestyle modification, exercise, balanced diet is the key.
Thank you.
Thank you. Thank you.
Yes. I think Rotin Girdhari as well is raising.
And Mr. Pawar.
Yeah.
Can I put my question up?
Yes,
Please
please.
go ahead.
Thank you. Thank you, Dr. Amit, for a nice presentation. I have one query. You said that there are medications for the viral cirrhosis, for the viral infection.
Yes,
But
yes.
in most of the cases, what I have seen is this, I mean, as you said earlier, the cirrhosis symptoms are very late to diagnose.
Yes.
So by
yes,
then, it is, I think, very late, because hepatitis C can be treated since it is a viral infection. It is treated in the early stages. The early stage, you
Yes.
don't get to know whether the patient is suffering with the cirrhosis or not.
Correct,
So
sir.
factually, though viral hepatitis C is almost non-treatable. That is what I feel. And probably the medication for viral hepatitis C, medication was, I think it was found very late in 19, probably, no, in 2000 only, 2015 or 16.
Yes,
Not earlier than that.
yes,
Am I right in that?
You're absolutely correct, sir. That was the reason actually my first step number one was to get yourself tested. Because if you are able to pick up liver disease at a stage when probably point of no return is not crossed, if you are able to treat patients at that point of time, then probably further worsening will not happen. But once the patient is in end stage liver disease, developing all signs of liver failure, has ascites, is developing complications because of liver cirrhosis, and then to start treatment, probably it is very late. But something is better than nothing. And so everybody actually they should get tested because when symptoms start appearing, usually we are late in the cycle. And regarding the treatment for hepatitis C, previously we used to have interferons, like they were used in like as you told, like in the early 2000 and till 2010 or 2012, 13. Recently, in last 5 to 7 years, we have excellent oral medications for hepatitis C, which is combination of sofosbuvir and velpatasvir, which is prime genotypic drug. And with that drug, actually, we can completely eradicate the virus. We can achieve cure for hepatitis C. But even if you achieve cure and there is a burnt out disease, like liver is almost gone, then in such cases, transplant will be the final option. So that is the reason actually I always tell like step number one should be just to get yourself screened for liver diseases and rule out viral etiology as a cause for liver disease.
One more thing, Dr. Amit. You see,
Yes.
I have some experience about this disease. My wife, she was diagnosed with hepatitis C. And that was diagnosed before her death. I think it was more than 13 years. And she survived
Yes.
for 13 years. And it was very early stage. Even then, I mean, all the thing interferon treatment did not work even at that time, but it was in early stage. And then she developed ascites and whatnot, all complications. At that, till
Correct.
that, then the transplantation was probably not suitable for her because of her health position. So
Other
so what I
organs,
feel is ultimately the medical science, as far as the liver is concerned, is not very much helpful except the transplant. And the second
so
thing I would
now
say,
things are
everyone should keep their lifestyles very healthy because liver is the
correct.
most important aspect of anybody's body. That's what I feel.
Correct. Correct, sir. I agree with you, sir. Liver is the powerhouse of our body. So without powerhouse, nobody can function. And regarding the drugs for hepatitis C, previously actually in the interferon era, sir, the treatment options were not very good. But now actually what we are seeing, if you are able to pick up patients with liver disease in the earlier stage, especially hepatitis C, we can give them cure. Hepatitis C can be completely eradicated.
Yes.
10 years back, probably this was not the case, but now actually with better drugs, we can completely cure hepatitis B, again with a disclaimer that it should be picked up earlier.
Early.
It should not be a burnt out disease.
Thank you.
Thank you very much. Dr. N. Purushottam Pawar wants to.
Yes, thank you, Dr. Amit ji.
Yeah.
You have explained it very nicely.
Thank you, sir.
And alcohol is correlated with liver cirrhosis and liver diseases. What are other reasons for the damage of liver and what precautions we should keep the liver healthy? Please.
Sir, if we have to enumerate the causes of liver disease, alcohol definitely most common or like should be on the top. Number two should be viruses. But number three, the fatty liver disease is an epidemic now. And probably, or if you statistically see, it has become the number one cause of liver disease. Because prevalence of patients with fatty liver disease is very high. 40% of Indian population approximately has fatty liver disease. Everybody who is harboring fatty liver disease will not have cirrhosis. Only like couple of percentages, up to like less than 1% of the patients with fatty liver disease may develop liver cirrhosis in future. But because prevalence or incidence of fatty liver disease is so huge, like 40%, we are 140 crore of population in India. So 40% of that will be around 60 crore. So even 60 crore patients who are having fatty liver, uska 1%, which will be like around 6 crore. Even 0.5% will be around 3 crore. So the prevalence of that disease actually becomes very huge. So these are three main causes. If we have to go to rarer causes, there may be genetics like Wilson's disease, which can cause liver cirrhosis. There may be autoimmune liver disease. Many a times, especially females in their 40s who are harboring any other autoimmune disease like thyroid, अगर उनका चेकअप करते हैं तो पता चलता है कि liver enzymes are elevated and they're also harboring autoimmune liver disease, which again can lead to liver cirrhosis in future. So, cutting the long story short, good lifestyle, no to alcohol, getting yourself tested. These three things actually, and avoiding over-the-counter medications, these 3 or 4 things actually are the real way to like liver health.
Okay, thank you, Dr.
Thank you.
Amit. I think
Thank you.
Rotarian Deepan Shah, are you there? You have raised the hand. Rotarian Deepan Shah, please unmute. Please unmute.
Doctor?
Yes, go ahead, please. No, we can't hear.
Please unmute yourself, sir.
Doctor?
Sir, it's not said, but I wonder
Yes.
why we can't hear.
No, it's some problem there, Rotarian Deepan Shah. We can't hear your voice. There is, I can see one iPhone. Can you just switch on iPhone? Please switch on your video. We can see, otherwise we will not know who is.
Hello,
voice for the
yeah,
iPhone. Yes, please.
Baba.
Can you hear me now?
Yes, please.
Hello?
Yes,
Okay,
we can
wonderful.
hear
Yeah,
you.
we can hear you.
Yeah,
Yes.
thank you so much, Mr. Goel and our Secretary Ritika and all fellow Rotarians. I'm much appreciated Dr. Singh, Amit Singh came show, and it is wonderful, very detailed, clear
Maza, maza.
instruction and yes. So my questions to you, I have 2-3 questions, but it's up to you, depends on your time. So number one question, in India, how long waiting for liver transplant, right? If someone has a condition, usually how long it takes time, and then how does the waiting list system works in India? So I will start with these 2 basic questions, and then one more question. If we have and our president permits, then I will ask another question. Last question.
Sure,
All
sure.
right, go ahead, sir.
Sure. I'll be briefing about transplants. When the patients actually with liver cirrhosis are into end-stage liver disease, and we find out that like the apex of medical therapy is reached. So for such patient, what can give them cure is liver transplant, as you correctly mentioned. There are 2 ways in which liver transplant can be done. Number one is live donor liver transplant. The other one is cadaver liver transplant. Unfortunately, the majority of transplant, I would say like more than 90% of transplant, what happens in India actually are live donor transplant, in which one of the family members comes ahead and after evaluation, we do the checkup and we come to the conclusion that we can take a part of the liver from donor and we can put it in the recipient. The other way out is cadaver liver transplant, in which we have to list the patient in his blood group after doing a thorough investigation to make sure other organs are healthy. In that case of cadaver liver transplant, waiting list actually is huge. If you ask me, we are listing 5 patients, only 1 patient will be getting an organ from the society. How it works? Usually it is zone-wise division, like in Madhya Pradesh and Gujarat and Maharashtra, they come into the central zone. We have to list the patient with the SOTO authority. And if our hospital is generating an organ because of people like creating an awareness, if organ comes from our hospital, then probably patient who are listed in our hospital will get some amount of priority. If we don't have a recipient in our hospital and we are generating an organ, it will go to the common pool. And patients with highest MELD score. MELD score again is a score in which through which we can prognosticate patients with liver disease will get the organ. So these are the ways in which liver transplant can be done.
Wonderful. So last question, hopefully very quick. So usually the medical system insurance, right? The people, patients with normal, financial status. How? Because I see a lot of reading articles. There was last week I was reading someone case happen in Uttar Pradesh when someone has a cardiac events happen at home. When they take to the hospital, doctor asks within a certain time you have to deposit 800 lakh rupees, 8 lakh rupees, right? So medical system and insurance, it's what I heard in the news. It is true or everything covered by the government insurance policy?
No, sir. Everything is not covered by government in India. Usually there are government hospitals actually in which finances are covered by government. But unfortunately, in government hospitals, we don't have facilities of transplants. 1 or 2 odd centers might be doing transplants in government setup, but majority of the government hospitals don't have facilities for transplant. It is like the private sector, which has majority of the transplant facilities in India, and finances are not beared by government, but up to some percentage of the finances, like Mukhyamantri Sahayata Yojana, they probably will help. Like soon, Dr. Lal was telling me, like Ayushman Yojana, probably government will be covering some amount, which is not yet revealed, but maybe up to 10 lakhs or 15 lakhs in the transplant to be provided by government. But as of now, the ground reality is like majority of the finances has to be beared by the patients itself. In case they have insurance taken by their own, then probably it can help them. Government helping out the transplant, it is happening, but in a very limited way.
So very wonderful. So recently, one of our family members, we known for them, so they reach out to us from Bombay. They has to pass through some bypass, right? And they are looking for 500,000 rupees to raise from here. That's okay. That's not a question here. We can do that. But whatever media says, government says, state government, federal government, and at the ground level, root level for normal people, there is a severe hectic situation. What we see and what I hear and practically I see is much different. Unfortunately, but hopefully everything in the future may be clear out, especially people are living a poverty line or middle class for them.
I agree with you, sir. Like what we actually see and what is projected as a reality, the both differs. So as of now, in the field of transplant, very little bit of help from government, that too in specific pockets in very few colleges or very few institutes. Majority, I would say 98% of transplant in India is happening in private sector.
Okay, thank you very much. Thank you very much.
Thank you.
Rotarian Sunil Gupta has raised his hand. Rotarian Sunil Gupta.
Yes, good evening. Thank you, Dr. Amit. Thank you for a great talk. I have a question, and you can see like a nice background of the Golden Gate Bridge. I'm located in California, so it's a little early in the morning for me. But I also hail from Indore, so I love the city. But thank you for coming on our forum today. The question I had is twofold, right? This is talking about healthy living and maintaining a lifestyle. The first question is about body mass index or BMI, because our weight and height ratios, we kind of tend to follow the American Western system of your BMI needs 25. So how does that apply to the Indian body type, number one? And what is the right BMI to maintain, or the range of BMI, rather than follow the Western diet and recommendations? That's question number one. And then I'm going to come back to you about हमारा जो हम लोग फास्ट करते हैं अपने इंडियन ट्रेडिशन के हिसाब से, जो इंटरमिटेंट फास्टिंग या रिस्ट्रिक्टेड टाइम ईटिंग का जो कॉन्सेप्ट है, उसके बारे में बात करने की I'd like to talk to you about. There's controversy about if people do intermittent fasting, that increases cardiovascular risk and death, et cetera, et cetera. So it's a twofold question that I'm asking you.
Yes. So my answer to the first question is like body mass index is an inappropriate way of looking towards health, because it can be fallaciously high, it can be fallaciously low. So usually, if you ask me the number, Western population, like the target is less than 25. For Indian population, the target is less than 23. But it is not a very good marker, because it is not just your weight and height, it is the distribution of fat in your body. People actually who are having a body mass index of 23 also, they might be harboring fatty liver disease, because they will be having central obesity. होता क्या है कि आपका वेट कम है लेकिन पेट में पाउच सा निकला हुआ है, लाइक सेंट्रली पीपल आर ओबीस, दैट इज एक्चुअली अनहेल्दी वे. तो बीएमआई के बजाय जो दूसरे बेटर मार्कर्स हैं, which can be like waist circumference, which can be like assessing the quantification of fat in your body, जो कि impedance study से अपन कर सकते हैं, they are better markers. Just restricting ourselves to a BMI as a number should not be the correct way of looking at it. And to your second question, like for intermittent fasting, as I told you, like all these things, intermittent fasting, this diet, that diet, Mediterranean diet, all these things actually are more of like fashion. The basic formula lies in the calories. If you are taking less calories in 24 hours than what is required, and you are having higher BMI with fatty liver, then probably you will be benefited. Intermittent fasting is the same way of doing it, getting yourself into a caloric restriction pattern in a different way. So it is just way of restricting your calories. So intermittent fasting probably will help you, but usually what we see is if you just follow one pattern, your body will get used to it gradually. So people who are doing intermittent fasting initially couple of months, they will see the results. Then they will start seeing a plateau. क्योंकि बॉडी जो है उसको चीजों को उस हिसाब से एडजस्ट करने लग जाती है. तो combination of everything is always good. Like exercise, maybe if I tell you like we should keep on changing, we should not be doing the same exercise because you fit into your comfort zone. Once you fit into your comfort zone, your body will start adapting to it. The same is with the intermittent fasting. If intermittent fasting you are doing for a couple of months, it is okay. Then you should resume back to a different pattern of diet, and change is the way of doing it. But the basic formula is just to maintain a calorie deficit, that too of around 400 to 500 kilocalories. More than that actually can be even harmful, because our basic goal is to make ourselves healthy and stronger. If you start creating a calorie deficit of more than 1000 kilocalories or around 1000 kilocalories, in that case you will also start burning your muscles. So cutting the long story short, we have to restrict our calories, we have to take balanced diet, and we have to do combination of exercises. इस चीज को करने के अलग अलग तरीके हैं. One of the way actually is intermittent fasting.
Oh, that's it. Thanks for the answer. Related to that, I ask you. I know you keep stressing about a balanced diet. ये West में यहाँ पर हम लोगों को काफी pressure होता है कि protein ज़्यादा खाओ, right?
Yes.
And when I go see doctors here in the US, they say कि तुम लोग, the Indian body type has always got visceral fat and central obesity and things like that, because historically in our diet the protein is missing. So any conversation or any comments and your opinion about kitna khana chahiye protein versus carbs वगैरह?
So definitely, sir, this is the problem with Indian body type or Indian diet. Majority of the diet what we take actually is full of carbohydrates. We don't take much of proteins. Usually the recommended dose of protein for a person who is otherwise healthy is about 1 to 1.2 gram per kg. People who are exercising, doing bit of cardio, heavy exercises, they can go to 1.5 to 2 gram per kg of body weight of protein. So person who is about 60 kg of body weight should take about 90 to 100 gram of proteins per day. This is recommended dose, and I think everybody should try to take this. Because if you are not, see, actually, muscles are the second liver in our body. If we start losing muscles, then we'll have problems. So for building the muscle, you require protein. And our diet actually, unfortunately, is full of carbohydrate. We have very less proteins. So definitely we have to take protein. Recommended dose usually is about 1 to 1.2 gram per kg. For a person actually who is just living a normal life. Too much of exercise, then we have to raise the bar and we have to increase it further.
Okay, thank you very much. I think Rotarian Rupa Arora.
पहले ड्राई दो कि फुल्का बनाऊं?
Rotarian Rupa Arora.
ड्राई.
गुड इवनिंग एवरीवन. डॉक्टर अमित, मैं पूछना चाहती हूँ, पहले तो मैं बता दूं, आई एम अ लिविंग लिवर डोनर. 2011 में मैंने अपने हस्बैंड को कंप्लीट राइट लुक डोनेट किया था, जो कि 65% था. मतलब ये तो मेरे को पता है कि लीवर में हमने खाने पाने का कैसा ध्यान रखना है और एक्सरसाइज करनी है. इवन देन मेरे को, जो मैं डायग्नोज हुई हूँ, फैटी लीवर ग्रेड 1 से डायग्नोज हुई हूँ, और मेरा जो लाइफस्टाइल है खाने पीने का तो सिंपल ही है. 1 महीना पहले मैंने पीजीआई में डॉक्टर अजय दुसेजा है, जो कि हेप्टोलॉजी के एचओडी हैं, उन्होंने एक फैटी लीवर पे सेशन अटेंड किया था. तो मैं और मेरे हस्बैंड दोनों ने वो अटेंड किया था. तो मुझे वहां से पता चला था कि फैटी लीवर के लिए कोई आपको बॉडी में सिम्टम्स अपीयर नहीं होते, एसिम्प्टोमेटिक होता है. और
जी जनाब।
तो उन्होंने मेरे को रिसर्च के लिए भी लिया है, और मेरे ब्लड टेस्ट करवाए, ब्लड टेस्ट पे मेरे LFT बिल्कुल नॉर्मल थे,
जी
जो
जी
SVOT थे, SGP थी, मतलब सब कुछ नॉर्मल था। उसके बाद डॉक्टर साहब ने मेरे को अल्ट्रासाउंड करवाने के लिए कहा। उसमें मेरा फैटी लिवर ग्रेड 1 आया। फिर उन्होंने मेरा फाइब्रोस्कैन PGI में ही किया।
फाइब्रोस्कैन
तो
जी।
मतलब मैं प्री डायबिटिक भी हूँ 7-8 महीने से। तो मैं पूछना चाहती हूँ, मुझे कौन सी प्रिकॉशंस यूज करने चाहिए ताकि मैं अपना लाइफस्टाइल नॉर्मली रख सकूं।
Number one is exercise. You have to start exercising. You
ओके।
should do at least 200 minutes of workout in a week, which should be
ओके।
a combination of cardiovascular exercises coupled with weight training. ये आपको
ओके।
number one करना है. How was your FibroScan, ma'am? Like, if I can.
सर इसकी वैल्यू जो CAP शायद होती, वो 219 था, IQ और 14, LSM था 5.9।
LSM
5.9।
was 5.9.
यस।
So FibroScan, ma'am, is a test which help us tell कि liver में fibrosis तो नहीं हो रहा. यूजुअली
ओके।
होता क्या है कि फैटी लिवर डिसीज में क्वांटिफिकेशन ऑफ फैट इज नॉट मच इम्पोर्टेंट. इट इज क्वांटिफिकेशन ऑफ फाइब्रोसिस. फाइब्रोसिस मतलब लिवर में स्कारिंग होना, है ना. अगर
ओके।
लिवर में स्कारिंग होना चालू होती है तो फाइब्रोस्कैन में नंबर 7 के ऊपर जाने लगता है. आपके केस में जो नंबर है वो 7 से कम है, 5.19 है. So your liver as of now is not having fibrosis, which is a very good thing. For you, the number one thing which can improve the quality of your liver actually will be exercise. So start exercising at least 200 minutes in a week. And second, try to maintain a calorie deficit of around 300 to 400 kilocalories per day. आपको जो भी खाना खाते हैं उसका कैलोरिक इंटेक कैलकुलेट करिए और अराउंड 400 किलो कैलोरीज का डेफिसिट क्रिएट करिए. अपना डाइट चार्ट इस तरीके से बनाइए कि उसमें 1 to 1.2 ग्राम पर केजी प्रोटीन हो. So if you do these three things, then probably you'll have a healthy life. And you are a
थैंक यू
proud
सर।
donor, so definitely you have given back to society and to your family. We are proud of you.
थैंक यू सर, थैंक यू वेरी मच।
Thank you.
Thank you very much. Any other question, or shall we? Any other question, please?
Can I ask a follow-on question, sir?
Yeah.
I'm
Oh,
sorry.
yes.
Yeah.
Okay.
So Dr. Amit,
I will just mention to Dr. Amit that Rotarian Sunil Gupta is a kidney recipient, living kidney recipient, and his wife, she has donated her kidney to him. Yes, Rotarian Sunil Gupta.
yeah, thank you. You know, when we talk about 1 to 1.25 or 1.5 grams of protein per kg body weight, obviously my case is different because I only have one kidney, right? So thanks to my wife and thanks to this group of really good people trying to increase and create awareness of kidney organ donation. So in an Indian diet, how do you go about getting that kind of protein in a day? You know that's the most difficult thing that I find personally. So this is a personal the question coming from my own personal experience. So the kitni dal kha kitna paneer kha sakte? I mean, can you quantify some of that?
Yes, yes. Second, actually, problem क्या होता है कि like if you are totally vegetarian and you are taking all quantity of protein from vegetarian diet, so like biological coefficient of vegetable protein, their absorption is relatively less. जैसे अगर quantify करने जाए तो we used to tell like soybean contains about 30% of protein. But when you start eating soybean, the bioavailability is very low. Although you are taking 100 gram of protein, it contains 30 gram, 100 gram of soybean, which contains 30 gram of protein. But absorption नहीं होता. बेसिकली जो वेजिटेरियन प्रोटीन है उसके साथ प्रॉब्लम ये है कि इट हैज पुअर बायोअवेलेबिलिटी. तो ऑप्शंस हमारे पास क्या बचते हैं? देन ऑप्शंस टू अस एक्चुअली पनीर. वी कैन इंक्रीज द क्वांटिटी ऑफ मिल्क. वी कैन टेक कॉम्बिनेशन ऑफ पल्सेस. वी कैन ऐड अ बिट ऑफ सोयाबीन. एंड देन देयर कम्स द हेल्प ऑफ सप्लीमेंट्स. देन तो फिर सप्लीमेंट्स अपने को लेना पड़ता है, विच कैन बी वे प्रोटीन, विच वी कैन ऐड टू अवर डाइट. And people actually who can take non-veg, egg is something which is the reference protein, because egg के साथ अच्छी चीज ये है कि egg has very good bioavailability. जितना ग्राम ऑफ एग अपन खाते हैं उतना प्रोटीन बॉडी एब्जॉर्ब कर पाती है. वेजिटेरियन फूड के साथ ये नंबर पुअर होता है. तो वी कैन टेक एग. People actually who are taking non-vegetarian, obviously they can take chicken and meat and all those kind of stuff.
Okay,
So
thank
I
you.
agree with you. The options limited, but then in that case we have to add supplements.
Okay,
Got it.
thank you. Thank you very much.
I just wanted to ask that now the time is very limited, so I'll have to stop. Is there a way I can clarify some of the questions I have in other platform, Dr. Amit?
Yeah, you can clarify. You can ask.
Means
What
so-
exactly is your question, sir?
Please ask.
Yes, Dr. Sudhir, what is your question?
The question is, there were two relatives of mine who had very extreme habits. One was, eating earth, and the other one drinks a lot. The second one is surviving. The first one expired at the age of 14. What makes, these things easy to understand for us normal people who are not physicians?
See, drinking too much of alcohol actually is a behavioral problem. Patients like this, they will need help from de-addiction specialist, a psychiatrist. So that itself is a special branch in itself. So people actually who are practicing de-addiction psychiatry, they will help them out. And second, actually, people who are taking earth or taking like जो मिट्टी खाने लगते हैं जिसे हम medically पाइका बोलते हैं. Usually, they will be subset of patients actually who will have some amount of deficiencies in their body. And again, sometimes this subset of patients will be harboring other psychiatric diseases as well. So we'll also need to take help from psychiatrists in managing such subset of patients. So it is not only the role of hepatologist, इसमें psychiatrist का भी अपने को help लगता है. And every patients actually to whom come to us with history of alcohol-related liver diseases, we always take help from de-addiction psychiatry. That is also very important. That itself is a stream.
Okay, thank you. Thank you very much, Dr. Amit. And I think over to you, Rotarian Ritika Gupta, for vote of thanks.
Thank you very much. So Dr. Amit, I myself have a question to ask. So how is it that one can actually know that we are gaining on muscle weight? And, whatever weight gain is happening, even when someone is working out, is actually muscle gain or like fat gain. Is there a way to figure that out?
Yes, we can do the impedance testing actually. We can have, there are various devices in which we can analyze body mass composition. So you stand on a device, it can tell you like how much percentage of fat is in your body. It can tell you how much percentage of muscle is in your body. So through impedance testing, it can be very well tested. And in fact, I tell to all of my patients, your goal actually should not be to lose weight. Your goal actually should be to lose fat in your body. होता क्या है कि we are obsessed about weight machine. हम बस वो नंबर पे काटा देखते रहते हैं कि हमारा weight कम हो रहा है या नहीं. Losing weight is not important, but losing fat is important. तो इसीलिए combination of cardiovascular exercises coupled with weight training is important. If you just carry on doing cardiovascular exercises, you'll start losing muscles.
Okay, and that also brings me to a question. Many people have a misconception or just a belief that, once you start weight training and if you just drop in between, then you tend to gain weight. How much is that true?
No, this is all myth actually. See, it is vice versa. It is a vice versa. See, if you are doing too much of cardiovascular exercises and you are losing too much of weight in a short period of time, such are the patients who have very high chances of rebound. See, because muscle is the furnace in your body which can burn fat. So, सिर्फ cardiovascular exercises से अगर हम weight loss करते हैं तो rebound होने का risk ज़्यादा होता है. On contrary, if you are building muscles, doing gradual weight loss, chances of rebound will be very less.
Okay. Thank you very much.
Thank you very much.
Yes.
Right. Thank you very much, Dr. Amit. That was a wonderful talk. And for today's session, I would request Rotarian Girdhari Agarwal to please give a vote of thanks to sir.
I would say that I've seen a very good presentation regarding the liver diseases by Dr. Amit. And I thank him very much. And I thank all the present members and everyone who participated in this discourse. Thank you. Thank you very much.
Thank you. Thank you, sir.
Thank you very much.